how do we work together as physicians and our nurse practitioners or PAs? How do we actually do this? Well, one thing is that we decide on when to use this tool and how to go about doing it. So who is seeing the patient? If I'm seeing the patient at year 4, I will order it. If Katie is seeing the patient at year 4, she will order it. And both of us introduce the idea that we plan on ordering this test in the future earlier in a patient's treatment course, but we don't actually order it until year 4. We make reminders in the chart, which helps us. And then whoever orders it, we make sure to close the loop and have a follow-up visit about 6 weeks later to discuss the results. For me, I request a telehealth visit, unless a patient really wants to come in, a telehealth visit about 6 weeks after ordering the test to discuss the results.
I think that one of the things that we do that's very helpful is Dr. Callahan will create a plan, right? There's the initial plan in the note when she first sees the patient. It's just kind of like a summary of what this patient's treatment course is going to be and what's going to be included. And it can include, we're going to do chemo and radiation, and then she's going to be initiated on this therapy. And then like somewhere under that, it's very helpful then to write that like one sentence or phrase, we'll plan to order BCI. And so every time we're in the know, we see it, because I think it's easy to lose track of time, you know, patients diagnosed and kind of like year after year goes by, and you can forget that this is something that you want to do. And so incorporating it into the plan is kind of like a visual reminder. And then there's also been times where I've wanted to order it and I meant to talk about it with the patient, and then something happened, right? Because patients come and sometimes they come with a laundry list of things and new issues, and it's not appropriate to talk about BCI at that visit. There's other things that need to be addressed. And so then when I'm charting later, I put in the note, you know, we can talk about this at the next visit. And the way that Dr. Callahan and I work is we're often switching, right? So she'll see the patient and then I'll see the patient. It's not a perfect system, but it happens like that a lot. And so if I see the patient and I write, you know, we'll plan to order at the next visit, then she sees that. And that's also a visual clue. Like, it's time to order the test. So that's very helpful.